We have witnessed the emergence of a previously unknown pathogen.
On December 2019, a pneumonia of unknown origins is first detected in Wuhan, China.
The coronavirus presents a public health emergency in the United States.
By February 2020, a global public health emergency is declared as the virus spreads like wildfire around the world. Hundreds of Americans fled the epicenter of the outbreak in China, placed under a strict quarantine at U.S. military bases.
This is the first time in more than 50 years that CDC has issued a quarantine order like this.
The U.S. already had its first known human-to-human transmission of the virus.
He was put into isolation when public health learned that he had developed symptoms.
By the end of February, global air travel had been restricted and the CDC was sending out a warning.
It's likely that this virus will cause a pandemic.
Officially declared a global pandemic by the World Health Organization on March 11, 2020. By mid-March, the virus brought the world to a grinding halt and life as we knew it had come to an end.
We cannot be in close proximity to each other.
Sporting events canceled.
The NBA has suspended games until further notice.
School buildings closed.
We have to take this action.
Movies and concerts shut down. Hospitals quickly overwhelmed, desperate for PPE as medical supplies ran short and testing was scarce compared to the need.
It's underlying why this crisis could get a lot worse, because we can't even get our arms around what's happening if we don't have testing capacity.
By April, the United States hit 1 million confirmed cases.
The reason it's so unprecedented, it exploded upon us.
The U.S. government launched Operation Warp Speed. The race to develop a vaccine was launched in May.
We're looking to get it by the end of the year if we can.
As cases skyrocketed in December, the vaccine was ready to roll out with the emergency use authorization of the first of several COVID-19 vaccines.
It looks to be roughly 95% effective at preventing disease, including 100% effective at severe disease.
Just a week later, vaccine vials were shipped across America and shots started going into arms. America's top health official says we will still face dark times, but remains optimistic that we will prevail.
I believe by the time we get to the fall, we will be approaching a degree of normality.
Emily Drewby, Currents News.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.